and I'll show you. Uh, this is the back of the spine. As you can see, these are the holes I talked to you about. The yellow things represent nerves. They exit the holes and they go out to all the different organs, systems of the body, like the ones I mentioned, plus the musculoskeletal system, which are the muscles. Now we have two types of peripheral nervous system. We talked about the central nervous system, which was the brain and the spinal cord. Now is the peripheral nervous system, the nerves that go outside the spine to all the other areas of the body. And the peripheral nervous system is categorized into two categories. First one is the voluntary peripheral nervous system, and the second one involuntary. The involuntary is referred to as what we call the autonomic nervous system or automatic nervous system. The involuntary, which means the function that it performs we have no control over, no voluntary control over. For example, the nerve that goes to the heart, we don't have any control over. We just, it works automatically without our control, and those nerves are nerves that don't feel any pain. There are no signals telling us that there is something wrong and there's some pressure on that nerve as a result of the misalignment of the spine. And those nerves comprise about 80% of the nerves in your body. Only about 20% are nerves that actually feel pain. And pain is a signal telling you there's something wrong. So if there is something wrong with the nerves that go to muscles, you feel pain and you have to go and take care of it. But something that goes to your liver or the heart or the pancreas or glands in your body, which control, harmonize the body, make sure everything works well, you have no way of knowing that there is a problem and there is a pressure on the nerve that affects the signal transfer of the electricity to those areas to nourish them as much as they need to be nourished. This can cause a lot of problems, and if it is taken care of, it has incredible effect on the health, the overall health of the body, and also for the maintenance of body's health. Now we covered the nervous system. We covered the nerves going out to the organs, and we, as a result of the misalignment of the spine, there will be pressure put on these nerves. Like you see, there's a misalignment. It's a pressure on these nerves affecting the electrical transmission of the nerves going out to the different tissues of the body. Let's just say it's a muscle. The muscle is over here. And when this is under pressure, you feel nerve in this end. And when it goes to a muscle is not nourished enough. The muscle starts feeling spasm. It gets shorter. It gets tight. And when it gets tight and short, these are the attachments. As you see, these bony structures are attachments of the muscles. They're attached there. And when they get shorter, they pull on the bone and they throw it out of alignment. And also in the muscle end, there is pain as well, because the muscle gets tight and puts more pressure on the nerve on the other side. So bone end and muscle end causes problems. Now, in order to correct this, first of all, you might ask, what causes misalignments of the spine? There are three major causes of misalignment. The first one is an obvious one, which is physical reason or physical impact, by actual physical impact to the spine, throwing the alignment off. This is caused by an accident or a fall or anything like that. Also, it can be due to how you carry yourself, your body, your posture, the way you sit, the way you slouch, the way you walk, the way you sleep, can cause the misalignment over time. The second reason is called emotional. It has to do with stress. The more stress you have in your in your life, which I think everybody does, as far as I know, except that I met some patients of mine that claim they don't have any stress, and not currently, not in the past. I find that hard to believe. However, when I work on their body, I realize, maybe they're not lying, or they're telling the truth. But anyways, some of them are past 80 or 90, and they're in better shape than someone in their 20s or whatnot. So when you have emotional stress, stress causes a change in the conductivity or transmission of electricity in the nerves. And when that happens, it affects the musculature around the spine, making it tight, making it very, increases the spasm, making it shorter. And those pull on the vertebra and throw it out of alignment. That's how you see pain arises when you have stress and suddenly you feel like your leg starts having pain. This is how it is, how it comes out. So the third reason is called chemical reason, and it has to do with what you eat, the environment that you live in, the alcohol or drugs that you use, and also more importantly, the prescription drugs that you take. Prescription drugs also can affect your whole system, including, of course, the nervous system, but can throw everything off in your spine. So we went over the three reasons why your spine can get misaligned. We went over the nervous system and how the problem happens, and now we should talk a little bit about how to correct the problem that we just mentioned and talked about. So there is a misalignment in the spine. The complex of this misalignment plus the pressure that's put on the nerve has a fancy name we call subluxation. Chiropractic corrects this complex called subluxation by performing adjustments on the spine to correct the misalignment. And when the structure around the spine is affected and it's tight, the muscles are tight and everything, when you put the vertebra in alignment, the muscles are still tense and short, so they can pull the vertebra out of alignment again. So by adjusting consistently, at a consistent basis, we take the pressure off the nerve little by little until the nerve starts becoming alive and getting more power and electricity in there, to therefore get little by little get the muscles that are around it relaxed. And when that happens, the vertebra goes back into, I can't even get this one in alignment. All right, now I got it. Can't even adjust this plastic thing. So once it does, and the muscles are relaxed and everything's relaxed, it holds in position. And that's where we can say we have successfully treated the patient.